doctors who are here, especially people in the medical field. Thank you so much for the sacrifice. And so we have to get started. But before we start the formal way that I wanted us to do, I'd like to feel like the room is a bit balanced in a way. So I want to request if some of the members seated at the end there, you know that end there, two gentlemen, it's only you. Don't look elsewhere. That it's only you, if you don't mind. So if you don't mind, you could come and sort of like come somehow. So that I want these 4 tables. Sorry, I'm not trying to say anything about you, but I might as well move you. I want these 4 tables to be our center of gravity. Make sense? Why? It's also because of the videographers and photography, those kind of things. Just to alert you, so many cameras, so just give them a smile, like someone who's enjoying their Friday. Excellent. So let's have that quick move, you know? Yeah, I don't mind. Feel free. This VIP table was for you. You understand? There, somewhere, something like that. Let's give them company. Thank you so much. Probably I will ask us, you know, the last guy who shall get in today, we shall clap for him, you know, because he has made it in a way. But please come by. Feel free. We just want to have those kind of 4 tables to be our... It's nicer. So that when I say please... network with someone, you're not looking quite a distance away. Thank you so much for that. So feel free, don't ask whose seat is this, just sit. There you go, there you go. And I know how it feels to be moved from a seat you have already warmed up, but don't worry, it's going to be a good time. Great, is that me? Okay, excellent. Yeah. So guys, no worries. Come. You know, I say the reason why they're afraid of this table is because, you see, like, especially for you see, they're all men. So it will be important to have a lady there. It will be very important to have that, you know. Somehow there, you know, that's really good. Yeah, that's lovely. Excellent. Lovely. This is good. So in honor and respect of the 2 nations represented here, I think we would better get started. So I want us to kindly all stand for the anthem. So please stand. We shall have 2 anthems. We shall have the Kenya anthem, just a verse, and the Saudi Arabian as well anthem. So let's get started. There you go. Don't sit yet. I know you're very quick to sit, but because this is a health event, we shall be healthy. I'm not saying that we shall stand all through. So if you don't mind, the ladies who have just joined us, welcome. Yeah, that's your table, that kind of thing. And the ladies on this end as well. If you don't mind, there's another one very close there. That one is reserved for government. I'm joking. Just a joke. It's a joke. Just come this way. Thank you so much. Oh, Citizen is here. There you go. This is our biggest TV station. Thank you, sir. We appreciate it. Can we clap for you? Anyway, just make sure we're on air. Thank you so much. So this is what I want us to do. Just look around. just around in a nice way, and I want to make you a bit uncomfortable because you're going to take a picture with the person who gives you a better smile, whoever it is, all right? Just look around, give them a fist, and then take a very nice selfie picture. For the generation that doesn't understand a selfie, it's a picture you take with the front of your phone. Huh? You know that kind of thing? And then you do that, all right? So I'm going to check with the CEO here. So just follow. Oh, have you? Yeah, clean the camera, do that. Just take us. You can join us, man. You can join us, Dr. Ahmed. There you go. Lovely. Yeah, just a good smile. There you go. Yeah.
Thank you.
Thank you so much. I'll tell you what to do with it after that. Once you have taken, some people didn't take. Did you take? Did you take? Just check it. Okay. I think what we did, that was a men only, so I'll have to do a group one because of all these people. Ready, guys? My table? Excellent. Ready to go? Thank you so much. You can take your seats. You can take your seats. Some people are complaining my neighbor wasn't smiling. I'm sorry. I didn't choose where you sit. I can only say I'm sorry. Yeah. So the reason why I'm doing that is because I was given a hashtag by the media. And for me, I normally say when you're given hashtags, they're meant to be used. So that's part of the reasons why. Could you pass me that pointer, please, on the table? There you go. So at least we can be able to do that. So if you took a picture, especially a picture with a person of the opposite gender, make sure you post it now. You don't want to go later on to answer questions. Who is this on your phone? Later on. So please, let's have, this is a Friday evening, so I'm not going to be as serious as some people have seen me in some other places, so it's going to be a very easy, good time and have that. Tech team, if you don't mind, you could give me my slides. I think that would be very good. There you go. So what we want to do is use that particular hashtag. There you go. Yes, there you go. So that's the hashtag. So post it. If you're on LinkedIn, post something, say you're here. Probably could put an expectation there, something nice, all right? The hashtag is what? Sage Healthcare, there you go, or medical tourism. Just try do that. And I was told by a certain person, I'll mention later, that the first people to post are going to get a ticket too. Now you see, now people are doing it very fast. In Kenya, when gifts are given, it moves faster. Excellent. So please share it out so we can tell the world that this is happening, that we are having a conversation about healthcare. Yes. And Sage Healthcare is right here. There you go. Thank you so much. Oh, somehow the numbers have grown. This is good. When we get closer to each other, it looks very nice. So we have a very nice packed program that is going to be straight to the point. I like that. So, but first, some quick house rules. One, if you need to visit the washrooms, it's right opposite us. I think this was a health designed way of just getting here, so you don't have to go too far. So straight out, and you're direct. I've asked the security whether there's any planned fire drill. I've been told no fire drill. So if you hear the alarm, get out as fast as possible through those particular doors. Wi-Fi is free. You only need to accept the terms and conditions, and you have very fast Wi-Fi for yourself, which is very good. And I'm so sorry. Anytime I moderate events, I am those kind of guys who like people to participate in it. And normally I say, even when speeches are being brought to you, just listen in, and you have any question, ask it. So I like to ensure that people do that. So bear with me if you came to just sit and listen, because I would want you to interact with me as much as possible to at least get something out of this. There you have it. So before I move on, I think that should be the part of the housekeeping. If you don't mind, your phones as well, if you don't mind. I know this is a Friday. You could be receiving many of them right now, so please make sure it's on silent so that at least we're able to flow. That being said, I think without further ado, we just get straight to it. Allow me to also just remind the people that if you feel you're having a bad hair day, especially for beautiful ladies, because of data protection, if a photographer looks at you and you can see this one is directly taking a picture at me and I don't want it today, you can signal. They will respect that. Just signal that, just to alert you that we're doing that. So once again, good evening, ladies and gentlemen, distinguished guests, and everybody who is here. Karibuni sana to the Sage Healthcare Concierge Service Strategic Dialogues right here at the beautiful hotel that has been put in place very nicely for us to enjoy the dinner. I would like us to note that tonight we want to shape conversations about healthcare. There's a lot of things that have gone around here. In fact, we're just having a chat before the time came by of just I was told the county by one of my colleagues here, not my colleagues, I'm not a doctor, one of my good friends, I've met him today, and he was telling me this is 2 days when they have signed an MOU. It has been about three and plus months of a strike. But who has been affected? It's the people. It's the people. And some of them have very dire cases, and it's just that we cannot report as it is, but you will hear them coming up. And this is unacceptable, honestly, when we can have this kind of things. We need to have as many alternatives as possible. And also, just to also mention, what a time when we, have we finished the days of mourning? Is this day 7? This is day 7. This is the last day of mourning. Yeah? Oh, we are still mourning, eh? Sorry, I'm just checking. It's going to be long, probably 30 days. I think the government's was 7, but for us it's 30. Just checking. For the ones who don't know, we lost a very patriotic man in this country. His name is Raila Amolo Odinga, the Right Honorable. And, you know, interesting to see that people may actually have different opinions, but the fact that he can travel somewhere and get medication here and there means we should be able to make it as easy to do that as possible. Because people have choices, is it? Just the same way some of you here locally choose a certain hospital and others choose another. I can give an example. When my wife was given birth, we got a very good referral for the first time to this particular hospital. Then we met another person who had a very bad story of the same hospital, so we went to theirs. But when we went theirs, another one had another story of that. So we were left saying, you know what? Everybody needs to go where they feel fine. And I think that should be what the conversation is all about, that you need to get access to healthcare where you want to be. So thank you so much. So let's engage as much as possible. Let me check very quickly, if you don't mind. Could you type that on your phone? Wi-Fi is free. Just type that, slido.com, and the passcode where there's a hashtag, just put Sage. There you go. Just do that. Just do that if you don't mind. I have minutes to do this, so don't worry. I have very good minutes to do this. There's a reason why I want us to do that. So say slido.com and then just type in Sage. Very quickly, that should not take too much time. We have, in Africa, we boast of the fastest internet, so we can move faster than this. Let's check who's in the room. Your name and organization, please. Just type in very fast. Who's in the room? It should be first. It should be on your phone right now. Let's see who's going to do this first. 4 persons are typing. Who's going to be the first one? Let's check. So as I said again, I don't allow people to just sit back and see, oh, Jim Munyao, Persis Insurance is here. Where's Jim? Jim, where are you? You were the first one. Jim. Hey, man. You were the first one in your class, huh? Just checking. Very good, very good. Let's appreciate Anita as well from Heritage Insurance, EHS Fertility. Is that a person? Just checking. We have Esther from Citra Africa Insurance. We have Ramas Ibrahim from Empowerment Nexus Africa. Zainab Bashir from RG Radio. We have Kemunto from Kenya Medical Association. Welcome. Jimunyao, thank you so much. Fadi Kode from Sage. Anita, Heritage Insurance. Who else is coming? Let's see. Ahero O. Willis. Welcome. Phoebe, welcome as well. We still have some 3 people who are typing. You remember your days in composition, those guys who will always be the last. We appreciate you. You're welcome here. Fadi, welcome as well. Someone is called County. Welcome. Welcome, County. We appreciate you. That one has to represent. Oh, yeah, and Dr. Tomboy is right here. I know. Excellent. Thank you so much. There you go. So 13. In fact, my sample was just 10. So there you go. Some people have decided to look and read with me instead of typing, right? Yeah. If you're the one, may we see you. There you go. Thank you so much. Lovely. Quick question, just to check on us. Just a quick pulse check. What brings you here tonight? It's okay. It's all right. And if you only came here because you had there will be dinner, it's fine. Just write it there. We'll appreciate you. Just in other words, it's just your expectations. It's always good to know. Yeah, when I got this invite, I came because 1, 2, 3. Let's see what your thoughts are. It helps. Some people are here to get informed. So I believe our speakers, you can take the note of that when you come here, give them as much information as possible. It's okay. Someone is to learn and interact. Good. Networking with other health professionals. They are right here. Get info on health tourism to Saudi Arabia. Yes, you'll get some good info. Thank you. To get insights on Saudi. Absolutely. To network. Lovely. Lovely. We still have some 7 expectations that we want to see. To network and learn about healthcare in Saudi Arabia. Yes. Learn about Sage. Talk about healthcare ecosystem in Saudi. Learn, network. To meet lovely and beautiful people of Kenya. Who's that? We need to. Oh, just checking. just checking. Networking and learning. More on health and tourism. Lovely. I like this. So we got it. A lot of people want to know about Saudi. A lot of people as well want to interact and network. That's okay. That's okay. Who has said that? Someone. Represent the boss. Someone has yet to do KPI, eh? I know. You are just all go. Go. I knew this would happen. Yeah, it's okay. We will ensure you don't get bored. It's all right. That's good. There's always be that last one person. We need to know who that is. But the beauty is that all of these people are anonymous. I've not made anyone get mad. Thank you so much for that. By the way, but let me ask you one more question. Just one more. It's a quick one. Then we can get started. What do you believe is the single biggest priority for transforming healthcare in East Africa today? In your own thoughts. Like this one, if we did this, it's going to transform healthcare. Is it access, affordability, skilled workforce? Is it infrastructure, tech, policy? Is it patient experience and trust? What are your thoughts on this? Just to know what you guys think. Don't overthink it. Just what you know. And you're like, if I had power and I became the CS for just a week with all the power, this is what I would fix. You try. I don't know whether I know all of them are there. But just that one thing that you know would help. Doc, I can see. I know what you would say. That would be nice to know. Let's see what you guys think. Hey. Access and affordability takes the day, right? Yeah. This is big. I don't know. I think Sage, you came at the right time because it's a big conversation. Healthcare in this country is a big conversation. I don't think there's a day you will flip your papers and not have something on health because of how important it is. So thank you so much, guys, for this. So let's have a good time. And so just to open the session for us, we have Dr. Ahmed Sheikh, the CEO of UMA. So please put your hands together for him as he comes to just really open for us. Karibu sana. Karibu sana, Daktari. Yeah. You're the first one, yeah.
How lucky am I? Just to, Bismillah. And distinguished guests, ladies and gentlemen, thank you for joining us. It is actually a pleasure to have you here. I know it is a Friday evening, and we don't take your presence for granted. We appreciate your presence. Earlier on, I was calling a friend of mine who is on his way coming, and then I heard his radio, the car radio, singing this song says, come on, turn the radio on. So I knew the man was going home, so I had to convert him back to the conference. But thank you so much. We really appreciate your time and your presence here. My name is Ahmed Sheikh. I serve as a group CEO of UMA Insurance. UMA Insurance is a Pan-African risk management intermediary headquartered in Nairobi with a subsidiary in Somalia, South Sudan, and Uganda. The strategic objective of UMA Insurance is to innovate risk management, insurance intermediation market in Africa through targeted product design, intelligent service, and convenient channel of distribution. UMA Insurance is the strategic partner of Sage within the East African community. This partnership is more than just business alignment. It is a commitment to ethical concierge service, one that places human dignity, transparency, and trust in the heart of every interaction. We are envisioning a system where a patient is empowered, where decisions were informed, and where care delivered with passion, all within the framework of ethics and international standard of excellence. UMA Insurance brings seamless risk management, customer service within this framework, and Sage brings expertise in premium, personalized, and healthcare facilitation. This partnership is actually a symbol of new chapter where business serves humanity and where healthcare, ethics, and innovation meet. And Sage is coming a time where most of Kenyan has got difficult experience in going for abroad for treatment, where someone will go and also come back with no much treatment happen outside. So the reason we are trying to bring this kind of service here, Dr. Muhammad will talk about it in details, is to do an ethical medical tourism. As we all know, and medical is a very emotional thing that most of the people who are traveling outside, they are not traveling as a social travelers, or they are not going to see the beauty of different countries. They are going there to have a good healthcare that understand their needs, that understand their problem, with the hope that they will get a good treatment and come back. So we have had devastating experience on reports on patients coming back from where they were and literally with no treatment at all. So what we are trying to do here is to do a, ethical, medical tourism where we prioritize your health and your well-being of your loved ones. So this is now the beginning of the journey to create an ecosystem where we are able to channel most of the clients who are passing through SAGE to a destination that we know they will get an excellent service, and they will also have, a reason to go there and also direct most of their loved ones. So it is so difficult to see your loved ones, in serious pain, yes. All we want also is to make sure that we give them the best attention and treatments, and that is the gap that SAGE is trying to, to fill it. And I hope tonight everybody will go out here with a very good information about the SAGE, about the good service that is happening, and about, in general, the health system and the health industry in Saudi Arabia. So thank you for being with us, and may God bless you. Thank you.
Thank you so much for that moment. Oh, sorry about it. It's okay. I think they're trying to test our health, but we're good. We're good. You have an insurance policy. I love that. Let's appreciate it one more time. Thank you so much for that. Yeah. So we need to make it easy to access, and thank you so much for the works that you're doing to help people have it easier. I saw in the expectations, people want to know about SAGE, big time. A lot of it. This is the moment then. So get ready to learn. So please put your hands together for the CEO, Dr. Mohammed Abdullah, as he comes to tell us more about SAGE, the entire brand, and what we can learn about it. Welcome, sir.
Ahmed, I don't have the insurance policy.
No policy.
Good evening, everybody, and really glad to have all of you here tonight. And I'm coming all the way from Saudi Arabia to say hello, and a pleasure to start this, I would say, talking to you about the ecosystem of healthcare in Saudi Arabia. And overall, let me start with something, Ahmed, you have touched base on a very important point. I know nothing but only for healthcare where people will donate and fundraise and try to sell whatsoever, maybe very valuable things to making sure that they maintain their health for them and for their beloved people. What we are trying to do here is not actually an exception. And what we are trying to do here is how to build up the journey, the seamless journey for patients coming from Kenya to be treated in Saudi Arabia in the best healthcare institutions and research centers, which I'm going to share further details with you tonight about that. Now, it's not about only going for treatment. When you go for treatment, you would like to receive your treatment in quality institutions, cost-effective way. And at the end, it's about the patient experience. It's about the journey that you will do. Patients are usually, and their families, are usually in a situation where they are in pain. They don't know what to choose, what is the best to go for. And sometimes they actually facing like different opinions. And this is what we have heard. So, like different opinions, different experiences. You want to making sure that you are going actually to the right institution. And by the way, this is what is sage means. So in English, sage means wisdom. Sage is also one of the herbs being used many years for treatment. And sage as well, and that's why we are here coming from all over this distance to here from Saudi Arabia, where Saudi Arabia globally expanding. So that's what we are trying to do in this evening. If I may have the presentation, please. So it's not only about a treatment. Treatment could be provided in everywhere or in many destinations. And definitely, if I ask somebody, if I'll make like a survey as what we have just said or done, you will find like maybe nobody knows about Saudi Arabia as a destination for healthcare treatment. And that's why what we are trying to do here. Next, please. So in the Kingdom of Saudi Arabia, there is a healthcare ecosystem that has more than 500. Thank you. Sure. So it has a healthcare ecosystem that has more than 500 hospitals all over Saudi Arabia. Those contains around 350 public hospitals and 150 private hospitals. Those are at various levels. And we have actually part of this where, like you have advanced medical facilities, the expertise in that most of the specialties. So we have like 50% of national doctors are actually trained in North America, like in the United States and Canada, as well as in Europe. And definitely, you cannot have only the hands, but you don't have the tools, for which you have also the state-of-the-art healthcare technology to enable and to support physicians and doctors to deliver the state-of-the-art healthcare delivery. Now, when it comes to high-quality care, then part of those 500 hospitals that I have just talked about, 115 hospitals, 115, are JCI accredited hospitals, Joint Commission International, that is a unified standard accreditation that is based in United States. Actually, the rest of those hospitals, so there is no hospital in Saudi can practice without having an accreditation. No physician can practice without having all the permissions related to the due diligence and making sure that they have went through a very sophisticated process to receive their permit to work. And at the end, it's about, like the competitive value that we are bringing together. So it's not only good hospitals or good doctors. It's about the service that we are providing altogether, including the cost-effective part of that. So this is a video about King Faisal Specialist Hospital. So King Faisal Specialist Hospital and Research Center is a 50 years old facility. It has around 3,000 beds around, like in the 3 cities, the capital in Riyadh, and then we have as well Jeddah and Medina, where it brings that all the sophisticated healthcare specialties into there. So we have the Center of Excellences into oncology, orthopedic, open heart surgeries, transplants, and when I'm talking about the transplants, I'm talking here about liver transplant, kidney transplant, bone marrow transplant, lung transplant, cardiac transplant, corneal transplant, name them. We are talking here about when it comes to oncology, even including the sophisticated, so surgical, chemotherapy, radiotherapy, palliative treatment, and talking even about like a procedure like what's called T-cell treatment, where this is very sophisticated, latest technology in treatment of cancer that is existing currently only in Europe and in some parts of United States, and we have it as well in Saudi Arabia. When it comes to cardiac transplant, so I just showed today, I shared with one of our colleagues here, like a video about 3 to 4 months back. It's been announced worldwide, the first ever robotic cardiac transplant surgery worldwide being done in Saudi Arabia in King Faisal Specialist Hospital. That brought actually the number of, usually for the conventional procedure, such surgery will take anything between 14 to 16 hours. But the robotic procedure took that down to 2.5 hours. So this is where actually we are talking about the quality of service and the delivery of care. So when we are here in Kenya, we are not talking about, and we are not interested to keep patients only referred from Kenya to Saudi Arabia. We want to do what we call BOT, build, operate, and transfer. So while you are referring patients, we are also happy to participate into training and supporting medical practitioners into that. So part of actually the journey where we have done with other countries, we bring doctors with patients, so they have a hands-on training while they are treating their home country patients. So that's like one of the reward into referrals to Saudi Arabia. Now, how we are, this is Sage, and we'll see this
Saudi
video.
Arabia is opening its healthcare system to the world. Sage is the healthcare concierge partner connecting global patients, facilitators, and institutions to Saudi Arabia's top centers of excellence. We manage the full medical journey from cross-border referrals and digital coordination to personalized care and after-treatment support. Working with government, facilitators, and private providers, we're shaping Saudi Arabia into a globally trusted destination for medical and wellness care. Discover Saudi Arabia, the wise path to healthcare.
So basically, we are bringing a forum or the platform. So we connect you not only to one provider or only to public or only to private, but to the whole network. So what we have done in Sage is, because patients, when they move from one area to another, they are not seeking a healthcare support, but they need also logistics. So they need tickets, they need visas, they need accommodation, transportation, translation, and then not only that, but they want also definitely the best of the best healthcare. And that's why we brought all of this. So we are connecting the dots to making sure that we deliver the holistic approach of healthcare services. And that's what we are trying to do here as well. So all what the patient will need or the family will need to do or the provider will need to do for referral is to share with us the medical reports. And not only that, we have what's called patient referral platform. So it's not by email or by WhatsApp or by, so you have a patient referral platform where you log in by your username and password. You log in the patient details, you attach all the documents, and then our back office back in Saudi Arabia will treat that. And along with that, they will refer the patient to the right facilities in Saudi Arabia. They will provide you back with some proposals, and that proposal will include what is the profile of the hospital, what is the profile of the doctor, and then what is the detailed treatment plan, and what are the costs looks like. Those are indicative costing. It will never ever change from anything beyond 10 to 20%. So I would repeat that. in our dictionary, there is no patient will be referred with an initial cost of $5,000 and it will end up with $50,000. That's not going to happen. So when you have that quotation, initial quotation, it will be usually some sort of locked, that anything between 10 to 20% could be varied. That could be less or could be above, but then that is the only margin. Not only that, in case of any medical practitioner will understand that even in literatures, there are complications reported into the literature. So we know that in specific procedures, there are some complications could happen. If something happened as well, the initial proposal will cover any complications. So even if we quoted like 10,000 and reach 50,000, what you have to pay is only the 10,000. That's like locked again. So what are we providing is patient referral, and we are also into partnerships and consultancies. Whenever there are like governmental or companies, we can provide them with the consultancy services related to maybe revenue cycle management, accreditation preparation, and building up the target operating model of operations into hospitals. And definitely for training, and this is very interesting part, for doctors, for nurses, for medical practitioners, and for admin in healthcare. We have actually a very dedicated platform to providing the training, LMS, the learning management system, where you have like courses provided to doctors or to nurses or to practitioners. And those are also supported in some courses by attending like physical or hands-on training in your country, or sometimes we get groups to Saudi Arabia for those training. And those definitely accredited either locally or internationally. So when we design actually our healthcare strategy, we do it with you as a patient journey. We build up the whole patient journey to making sure that we put the future for healthcare along together with you. So when we do the strategic consulting, then we develop with you the programs right for your healthcare facilities. And when we do the training, then we design it according to the gap analysis that we develop together based on your institution as well. And that is like something we have the subject matter experts to support your organization into delivering. So I actually, I would like more to focus on, the training part here, where, as I said, there are specific and focused training programs that we will be providing to doctors or nurses or medical practitioners, like infection control, nursing, where they can be specialized into critical areas like in ICU or CCU or kidney dialysis units and so on, where those are actually very sophisticated and very specialized training services for institutions. I have talked about this, but what I want to emphasize on is that it's a mutual strategic partnership that we want to build up here. It's not only to, refer patients to Saudi, but also in reward to that, we want also to build up the capacity. So for patient referrals, as I said, we have the state-of-the-art healthcare institutions where we can assign the patients to the right institutions to receive treatment. And definitely those are, according to the best practices in medical worldwide. So I'm coming to the end and happy to actually schedule meetings and see what is next step with your esteemed institution. Thank you once again for being with us this evening. And I look forward really to collaborating with all of you and see how we can take this to the next chapter. Thank you so much.
Let's appreciate Dr. Mohammed one more time. Thank you so much. This is very good, very clear, very articulate. I'm just trying to check on my slide whether anybody has asked any question. Oh, I can see one question. It's actually not a question, it's a comment. Access, quality assurance, affordability. Yeah, I don't know who wrote that, but it means you're a good student. You're following very well. Thank you so much once again for the clarity and all that. So feel free, if you check your fonts on the slide or on the other side of it, there is a part of polls and then there's the other part of Q&A. So feel free to engage because it's supposed to be an open discussion, anything like that. For example, you've had Dr. Mohammed talk about the exchanges, the trainings, all those kind of things. So if you have any questions, feel free. How are they facilitating this? How can this be done so that at least everything is well done and we can be able to access this? Don't leave here with any question. Talking about matters to do with partnerships and consultancies, accreditation, how do you go about that? So if you have any question, feel free. And if you don't have that question, ask for your doctor friend, or nurse, that kind of thing. So at least we leave here with very clear notes. So how are we doing so far? Just checking in on the room. How are we doing? Are we okay? So far, so good. Because I'm about just to invite the last kind of conversation for the day. So just checking in that we are all good. But remember, we told the hotel, Radisson Blu, to ensure there's a lot of water because the people who are here are health practitioners. You don't bring other things. Thank you so much for that. So we're going to now listen in to the final address of the day. I want to invite a very special person here to come and talk to us. I saw him walking towards me, so I thought there was another announcement that was coming in. You're only coming to take a picture. Okay, just checking. So Dr. Hassan Bashir is in the house. Please put your hands together for him as he comes. A round of applause, please come by. Come speak to us, sir. Karibu sana, karibu sana, karibu sana. This is your stage now. Come talk to us so that immediately after this, we shall be able to close and eat. Welcome, sir.
Thank you. Good evening, everyone. Assalamu alaikum. Talk about being thrown off the cliff. Hopefully, I will not land on my head. My name is Hassan Bashir. I chair the board of Oma Group. My sincere apologies, I came a bit late. And I was on a trip and arrived at JKIA at 5:30. So I was trying to make the loop to arrive here. I couldn't miss it. I don't know what to say following Dr. Mohammed. But suffice it to say that we are very committed to working with SAGE in the region, beginning with Kenya and a number of other countries as well. We're committed to the model they're bringing. We started a number of models, including some of the destinations that we know. There are a number of destinations for Kenyans in terms of healthcare referrals. They are very common destinations. They are newer destinations. And one of the key challenges that Kenyans have had over the last decade is the uncertainty around what is treated, how much it will cost, and so on. Some of the markets welcomed us, and we go there. We flocked, word went out, and then it so happens that after we got used to the route and the route destination got used to us, then things have been changing. People have been having challenges. I don't want to name names. I don't know, maybe they are the ambassadors for those countries here. So I want to be very careful. But really what SAGE is promising us, and we are committed and satisfied with their model, is taking the uncertainty out of the trip, the medical trip, and being sure that you will meet the right doctors, you will pay one price, predefined, pre-agreed, and all of us is known upfront, no surprises, not just a travel, take a visa, come there, and then your bill can go from, $500,000 Kenya shillings to 6 million, 7 million Kenya shillings. We have seen that happen. Those of us who are in the healthcare sector and the insurance sector, we have seen that. So we are trying to find a solution for that. For the Muslims, you can also do your Umrah while you do your treatment. So it's a win-win for those who will use these destinations. you can imagine, many of you know how tough it is to get the visa to Saudi Arabia to do the Umrah. Imagine you do your checkup when you're doing your Umrah as well. So it's one spend for double value. For the rest of our compatriots, our Kenyans, value proposition is what Sage is offering. I know that the brochure might give the standard, what do you call the standard proposition, and there are prices around the standard offer, and there are a number of other offers on the brochure, which are probably more advanced, and those probably require some description. What that advanced means? Is it complicated surgery? Is it So it's difficult to say beyond the standard what the price will be. But once the documentation reaches Sage, and as Dr. Mohammed said, the entire journey will be on the system. And so from the moment you are KYC'd as a potential patient to the moment you are flying back, all that is on the system, and you can see it as a patient, and also we can see it here in Kenya, and Sage can see it. Sage team can see it, and the doctors and so on. So it's not the experience we have had with other countries, other destinations that are a bit, a black box. You don't know what is inside. You put your hand in. There could be copra there, or there could be gold there. So this is a bit of giving us significant certainty. We're looking forward to rolling that out and working with Sage in Kenya and in a number of other Eastern African countries. And so let me take the opportunity to thank you all. And I didn't take a notebook and think, dig up to give a very intelligent speech. So I'm trying to survive here. Yeah. So thank you very much. God bless you all. Thanks for coming. Thanks for honoring us. And we appreciate your presence. Thank you.
Probably it was intentional so that you don't take too long on a Friday. But we appreciate you. Thank you. Let's appreciate Daktari one more time with a clap. Asante sana. Thank you so much for that. One of the questions that have been asked is interesting. Let me read it out. I'm sure if you already logged in, you can see that question, right? Someone is saying, and I think this is for you, Doc, because I think they really wanted to see, apart from the good things in the medical field, are there some interesting things that you can see in Saudi? So the question was, I'm just reading it out for you, that you have not shown us what? Let me read it. Yes, we have not seen the key areas of tourism that can complement the people who visit Saudi for wellness checkups. So probably we may need to show them the nice and the, come. Probably you have something. Yeah, that'll be nice. Yeah. He knows. Let's first of all tell you.
So this is a great question. There are actually the word of medical tourism or health tourism is a bit, if I may call it, a bit tricky, because sometimes I cannot call somebody who is traveling to be treated for cancer going for medical tourism. So they are usually like health travels more than like a tourism. So that's why I was at, and this is also part of our commitment. So definitely we can add the leisure part or the tourism part to the journey, but then we are also keen to making sure that we are focusing on why you are moving from here to Saudi Arabia. Because I'm sure if you want to go for leisure, then you will go for the travel agency, not for Sage. But then what we want to making sure that you get is the right healthcare delivery. Now, in order not to take this so prolonged, since 2021, maybe just immediately after COVID-19, Saudi Arabia started to do a booming, structuring, and then investing a lot into the tourism. So 2020 and before, nobody, we don't have even tourism visa. Today, there is what is called tourism visa. So people can apply for tourism visa and they can come for tourism. There are a lot like Al-Ula, like like the heritage areas in Jeddah, if you know the name of the city. So Jeddah, so Saudi Arabia is 2 million square kilometers. I just was explaining today, so it's like the size of Spain, Portugal, and France all together. And we have 35 millions of population, very diversified. Even like people, so you will find like people will wear this red. We call it shmag, by the way. So you will find people wearing red, and others will wear white. And like those are also from other area to another. You will find like a lot of, so the accent will be also changing. I'm sure you have very similar thing here. But then what I'm trying to say here is that it's very diversified. You have, so I'm coming from Riyadh, where the temperature there is around 45, 48 sometimes degrees centigrade. So you can smell some barbecue while you are in the, and you have cities where the temperature is 18 and 17. So those are very diversified areas. And definitely I can grant you that you will enjoy your time, whether you are coming to those 45 plus degrees centigrade, because there are some things suitable for those areas, and you can enjoy your time while you are also, like in a city like Abha, ABHA. Abha is a city where the temperature is 17 and 18 all the year. And definitely there are like a big sightseeing and tours, as well as big activities. And I don't want to, I'm sure all of you know, in 2027, we will have Asia Cup. And then in 2030, we will have the Global Expo in Saudi. And in 2034, we will have the World Cup in Saudi. So feel free to come and to enjoy your time in Saudi. Thank you.
Not yet, Doc. Now allow me to just use you nicely until everybody feels like we're getting the nice conversation. In fact, pass the mic to him, because guys, I can see questions are coming in. So there's a quick one here. Someone is saying, perhaps you can expound on how technology is assisting you deliver quality health care outcome. I hope you're not asking to copy, but hey.
A good driver in Formula One have, if you don't have like a Ferrari or Lamborghini, then you cannot be a good driver. You cannot win the race. So that's why we believe into technology. 2020, out of 2020, COVID-19, we learned a lot. We learned about teleconsultation, like robotic surgery. I was talking during the presentation about technology, where I said transplant of a heart in a 13-year-old kid was taken down from 14, 16 hours conventional procedure to 2.5 hours because of the robotic surgery. Wow. And this is huge. I mean, instead of opening the whole chest to do that surgery, it was 3 centimeters only. And, like very sophisticated. And that's why I don't want to go into a lot of medical talk, because that will open. Actually, so let me take another example. Everybody knows about knee replacement, right? Yeah. So we change in some situations the joint of knee to another artificial joint. Now those joints, not only because you are changing from real bone to a metal one, that's not the only part. How actually accurate is that? Because God created this differently. So if I have like a flexion of this degree, maybe he has a different deflection. Yeah. But then when we fix a metal artificial joint, it's the same, right? But it will be fixed for me and for him. But it cannot fit both of us, because we are different. What is actually in the coming, all the previous few years, we have learned like a lot how to change the conventional way of doing like joint replacements and others into more sophisticated sort of, like using the technology and the robotic part to making sure that you have the right, I would say, the right joint, so instead of, for example, post-surgery, you stay for 7 days in the hospital, now you can do the surgery, second day morning you are walking and painless, and you can go home like in 2-3 days. And you can do your rehabilitation while you are actually outpatient department. No need to be admitted inside the hospital. Right. All these are actually big differences that we have we have witnessed during the past 3 to 5 years.
Oh, that's interesting. Thank you so much for that. Sometimes in this country, they clap for someone once they have answered a question well. Yes. So people don't sleep. There's another one here. I think you can take this as one bunch. Someone is asking, what is the currency that the patients pay with? That's an interesting one. And do you have a plan to invest locally?
Sure. So usually the currency in Saudi, is Saudi Riyal. It's AR, and $1 equals to 3.75 Saudi Riyals.
Mm-hmm.
Now, that's because, we can accept both, so it could be both by Saudi Riyals. I think, people coming already for Umrah and Hajj, and not in thousands, and maybe hundreds of thousands. So it's not something, I don't want you to perceive that Saudi Arabia is like a new destination for Kenyan people. There are people coming there. And I have colleagues as well working for other corporates in Saudi Arabia, and they are from Kenya. I know one of the biggest optical chain in Saudi Arabia, they have most of their optical technicians are from Kenya. So I know that there are already population from Kenya coming and living there. Yeah. Now, when it comes to investment, today, our first baby step, saying, hello, we are from Saudi Arabia, we have 1, 2, 3, 4, and we would like to take this. If we are not serious, we wouldn't be here today. We have a flight in 6 hours back to Saudi. So we would like to making sure that we are delivering the right message to you, and we would like to take this hand by hand. The moment you are actually encouraging this to go to the next step, why not to invest? There is no harm. I mean, I'm sure you know that one of the largest investment funds worldwide is coming from Saudi Arabia. So there is no harm to invest.
Wow.
I can see Justin talking about something.
Yeah. You're confirming that it is true. Excellent.
Thank you.
That man is CEO of one of the largest insurance companies in the country. So if he confirms, it's true. Thank you.
And insurance, CEO
Yes.
of an insurance company. That means they take risk
Yes.
as a top priority.
Yes. Lovely. There's a final one here. I think people now want to eat. Do you assist with medical evacuations or repatriation in case of serious health issues?
Absolutely, yes. So let me tell you that we have anything from a very simple treatment, like a second medical opinion, online consultation. You can do that through us. And we can take a very sophisticated, a treatment plan by a midvac, ICU doctor, ICU nurse, going through, different countries, transferring. And by the way, by professional, I'm an anesthetist intensivist, so I understand what is the criticality of having a patient flying, and then what to do with such patients. So yes, definitely we do that.
Excellent. There will always be people who are not as good tech-wise, so you have to also check. Let me see, somebody who could not type and is feeling, I need to ask this one. Or my question was not typeable. Hey, Doc, I knew that one. This one was coming, so please go ahead.
Thank you so much. Thank you for the second option. I'm very conversant with technology, but the question was not typeable. My name is Dr. Mboya. Tom Mboya, I'm the county neurosurgeon, Nairobi. So I open and close people's brains and spinal cords. And our area has a lot of medical tourism. So many patients come our way. I think I mentioned to you in our earlier conversations, mostly from the neighboring countries who are already doing medical tourism into Kenya. From Somalia, some come from Ethiopia. We see people from Uganda and Tanzania, because our healthcare here is slightly better. But even here, we have Kenyans who leave the country and go to other destinations, as was stated earlier. Now, as a practicing physician, as a neurosurgeon, my concern is usually, sometimes they come to us after they have come from abroad. And so, are you putting also in place follow-up mechanisms? If patients come to you for specific care, will you also have physicians on the ground who, when they come back, can receive them and continue treatment?
Excellent. Thank you, Dr. Tom. The patient journey has 3 phases. One, before leaving the country, where we have to connect patients with doctors there, or sometimes doctors with doctors. That means the prospect or the potential treating physician in Saudi would like to speak to you about this patient before leaving the country. So this is before. During, we will have all the, like what I have talked about. And then definitely this phase where it's post. First of all, we have 24/7 support. So the patient can have accessibility to Sage customer care 24/7. And we have usually, so in most of the leading hospitals, we have physicians on call or physicians to support us. It depends if this is a critical or emergency situation, or if it's just a question. Or sometimes it's only a referral or like a follow-up question about the case itself. In all the cases, what we do is that we support all patients, at least, and we know that, at least for the following, like 2 to 3 months post leaving back to their countries, in order to making sure that they have the continuity of care. Now, while we are here in this visit to Kenya, we are building up some, like partnerships with some hospitals here. So we have, as you have just described, we have a vision to have like, like a follow-up assignment in some hospitals maybe, or with some physicians, where the patient, after getting back to Kenya, they can still have accessibility, and it will be very clear to whom they should be following up, in case if they require. Yeah, thank you.
Yeah, that question could not be typed. Now, I'm going to force some people to ask. I don't want anybody here leaving with any questions, so I told you forgive me. Probably I'm doing this because the kitchen has told me they need 10 more minutes. So please help me by killing these 10 minutes. So ask whatever question you got so that soup can be ready. So this table, guys, I'm here. I'm just going to pop up. Who else has a question before I start doing my other forceful way? Anybody else with a question? Guys, look at me. Look at me. Stop looking down. Look at me. Yeah, anybody with a question?
Can we reverse it?
Yeah.
Can I ask questions?
You cannot. That's a good one. Yeah.
Thank you.
Yeah. Yeah, go ahead. I'll choose the one to
I would like to start
answer.
maybe with, let's take this table. What was your expectation? And you maybe wanted to hear something that I did not talk about or I did not touch base on.
Yeah.
Any point?
Any point.
No?
There's one.
Yeah.
There's,
Please.
there's actually 2. Let me start there. Let me come to
Sorry.
you. Let me come to you because we need to hear you. Go ahead.
Really, it's not a question, but I think when I came in, I did not know Saudi Arabia as a destination for medical tourism, or rather medical care. It was actually a good surprise to be able to learn more about what Saudi Arabia is able to offer. I think a lot of us know Saudi Arabia as a place where we take our human resource for working. So it's quite good to note that. I'm from Kenya Medical Association.
Thank you so much.
So I think it means where she comes from, she's going to be the, we call them evangelists, people who
Ambassador.
tell everybody else, ambassador, that kind of thing, right? There was another one on the other end. Let me walk straight there. Straight there. We're doing well.
Good evening. So I had a question about the visa. Okay, so since Sage is going to be helping to get the visa, how long does it take? If the treatment takes longer, I know Saudi Arabia has a very strict, visa policy, and so how are you going to help?
Sure. Excellent question. Anybody has any answer to this, or should I? No? Okay. So before 2020, there was only maybe one type of visa for others to come to Saudi, that is Hajj. And if you are coming for Hajj or Umrah, then it was. You have only to go to Mecca and Medina. You cannot get out from those 2 cities. Today, there is a totally different direction and strategy for that. We have business visa, we have tourist visa, Umrah visa, Hajj visa, and recently after Sage started, we pushed for treatment visa, and we have it. So now, what will happen is that after you share your medical reports, we share it with the right hospital there. They have accessibility to a platform that is connected with the Ministry of Foreign Affairs. So what will happen is that they will log in the details of the patient, and this patient is accepted in our hospital. This will trigger sort of, you can call it an instruction, to the consulate in your country that they can process and issue the visa for the patient, or sometimes for companion, at least one. So for that, and the usual turnaround time for that is around 3 to 5 working days. Actually, during my visit here, I was also had the pleasure to meet, I visited actually the Saudi embassy to emphasize on this. And this is actually part of the deal where we want to making sure part of the seamless journey, the first step will be is accessibility to the country. But a great question, thank you.
Awesome, awesome. Thank you so much for that. You are asking them.
Still the soup is not ready?
Not yet. They have just signaled me 5 more minutes, which is good. Yes, okay. Yes. Uh-huh.
So what do you think, people are talking usually about price and cost and, do you think, and this is, I'm asking you about your perception, do you think really that the price is the only drive that you will choose this country or that country? So if you have 3 countries, one is $1,000, the other one is $1,100, and the third one is $800. Are you going to be cautiously selecting based on, for example, okay, why is this 1,100 and why is that 800? Or you will just pick up 800 blindly, and because this is the lowest price, go and hit?
That's a good one. Who's taking the first answer? Or do I
just
randomly
perception.
select?
I mean, this is just general, for me to understand.
There's an answer here.
Yes, please, go ahead.
Honestly, the price doesn't matter. What matters is that you're treated and you're healthy. So, yeah, in my opinion, the price doesn't matter.
No, but thank you. This is, it's important to understand, and thank you for this. Maybe I started my, the first presentation saying, like, people will sell anything. They will fundraise.
But Doc, pause there. For her, price doesn't matter. Let's get another opinion. There are some people here.
We will. No,
first thing is the price.
Definitely, but I will just, comment on, it's not only because it's really important to know that sometimes people will not ask about why is this 1,100 and why is that 800. It's your right to ask. Yeah. If this is a robotic, so you will do the surgery. I'm just giving an example. You will do the surgery. 2 days you are back to your home, painless. You don't have to stay for another 1 month rehabilitation, and you will pay another $300. You might electively choose to go for that. You will not go for the 800, and you will suffer for, especially if it's for you or for, father or mother or son. Definitely you want to making sure that you give the best solution. So I just want to encourage asking about why is this cheaper before taking the right decision.
All right. Chairman has something to say.
Yeah, to Dr. Mohammed. The experience in Kenya has been, or Kenyans going out for medical treatment to some of the countries. We have seen over the last 5-10 years or so, certain destinations that were good initially, but as the population of Kenyans that are going to, and maybe even other neighboring countries, as the population of visitors increased, a lot of new hospitals appeared, quacks also became doctors, and hospitals were created, so people fell into traps. Can you talk to the room, the audience, about how the SAGE formula, how hospitals and facilities are pre-cleared and pre-approved? Can you say something about that?
Sure. This is an excellent point, Dr. Hassan. There is usually a balance that we have to keep to making sure that, so hospitals has a capacity. And that's why occupancy rate in hospitals are very important, because you cannot overload the staff, overload the facility, and still you can get the same quality. For which I started as well my presentation saying that we have 500 hospitals, and out of this, we have noticed what are the capacity for those different hospitals to making sure. So if I have 100 patients, I'm not going to drive all 100 patients to King Faisal Specialist Hospital or to National Guard Hospital. And we know, we have what's called patient referral matrix inside SAGE, where I know where and what are the center of excellences for each and every specialty. So if this is an oncology service, I know which centers I can refer to, and based on the capacity of those hospitals, we will be referring patients to making sure that we deliver what we have promised. So it's a balance between, like the capacity of the hospitals. We know they have the quality, but we don't want to overload with beyond the capacity of their own, and then, yes, definitely, it's become like very commercial, unfortunately. So we don't want to go to there, and that's the promise, Dr. Hassan, that we have said. We want to making sure that it is a seamless patient journey with a high quality. And quality comes with a price. If you want to go to, like a less quality service, then it's available as well. And there are many destinations that they are actually, like sometimes let go part of the quality because they want to absorb more number of patients.
All right. I knew here there could be something burning.
Well, it's not something burning, but I mean, if we sit here and say price doesn't matter, we would be wrong. Price matters, and it matters a lot. It would be important to understand. I've looked at the list of prices, and it shows the standard. But there is the advanced and the gold and the platinum and what have you. Of course, that comes with value addition. What is important is, okay, it shouldn't be me too, but there is more that one gets other than the treatment that is that one receives. In this country, we have quite a number of hospitals. A delivery at the Princess Zahra Pavilion in Aga Khan, the delivery of a child there will probably cost the mother and the family equivalent of about maybe 8,000 to 10,000 US dollars. And you're getting a baby out at the end of the day. You go to another hospital, and probably it's about 2,000 USD. Now, there is a reason why somebody would want to deliver at the pavilion Princess Zahra and not in any other hospital. So what I would say is the proposed value addition has to be in tandem with the price that is proposed. In this country, insurance evolution has not taken off as much as other places. And many people pay out of pocket. They do harambes, they sell land, and there are a lot of things that goes into sending a patient outside. And it's important to appreciate that. And therefore, the packaging of this has to be something, because there is experience. When we are comparing prices, we have to look at what was being offered before. What are the sentiments of the people who are coming back? What is the result? How many people are surviving maybe 1 year, 2 years, 3 years after the procedure has been done? All those comparisons have to be done. It doesn't just depend on price, but what else? Sure. Thank you.
No, thank you so much. I fully agree and align with you. Price is a factor. What we are trying to say here is that the factor that will impact the price positively or negatively, up or down, is also something that a patient needs to be aware of and to appreciate. Because as you have said, it's the same normal delivery that will cost $8,000 in one, but then $2,000 in another. But I would like also to emphasize a very important point. When we are talking here about the different prices, we are not, because sometimes it's not only about the quality, sometimes it's about the hospitality part of the hospital. So I don't want you to come and pay trouble time what is normal in the country just because you want to have like maybe, like a Hilton or Sheraton or Radisson Blue hospitality. You want to get, so that's why we are keen to making sure that you are receiving the service in one of the approved accredited centers. Now, regardless if the chair is like this or if it's like a leather sofa, this is something different. If you want to take like a single room, private room, or you want to take like a royal suite where you have even like one of the royal suites I have seen where you have like a table with 32 seats for meetings for CEOs and for executives. But how much is that will cost you per day? 8,000 is per day for the suite actually, not for the treatment. And that's something for, like that we are not, like even offering unless somebody is asking for. So let me put it in another way. We don't jeopardize the quality of service because, any Kenyan citizen coming to Saudi, they will not say that I went to Muhammad Hospital or Hassan Hospital or X or Y hospital. They will say that I went to Saudi and I enjoyed my experience, or I went to Saudi and I did not like that experience. So we want to making sure that we standardize the delivery as much as we can across the board. Thank you.
So one last, yeah. I'm sure, Dr. Mohammed, you're hoping the soup walks in now.
Yes.
Yeah, but allow me to ask Brenda from the Kenya Medical Association, and from where we sit, and allow me to ask this question in response to a question you asked about what didn't we see in your presentation. More about the regulatory landscape as far as the practice of medicine is concerned is very important for us to note, because I know we've had patients who've gone to different destinations and not handled, necessarily the right way. And the path for recourse or whatnot was not really clear, and they ended up helpless. So knowing more about what regulation looks like for the practice of medicine in Saudi will be a good add-on for us to note.
Thank you so much. Maybe I just briefly touched based on this where I said like hospitals has to gain their license only after getting an accreditation. Having like a very standardized services is something that we are aiming as part of the ecosystem in Saudi. So for all patients, we have what's called patient's rights. Every patient before starting the procedure, they will have the right to see all their rights before starting the journey for treatment. Before that, as SAGE, you have the right to ask about the hospital, about the doctor, the profile of the doctor, the certifications of the doctor, how many times this doctor did knee replacement, why you are sending me to this, not to that. So you have all the right, and not only the right to have one proposal or one quotation, you have the right to have at least 3 quotations so you can judge what is this price versus what will be the quality delivered to you or what will be the service delivered to you. Now, when it comes to physicians, to start with, all physicians are actually going through a very, I would say, high quality sort of a training. Physicians start with medical schools of 6 years. Mostly they will do this in Saudi. And then mostly they will have it like, as I said, overseas, like in the United States or in Canada or in Europe or in any parts of that. But not only that, they are usually also participating in academic part of trainings where they are actually, like empowering and boosting their knowledge, and they have to keep it usually at the top by practicing as well. By introduction or introducing the new technology, they have, doctors, they have to keep their skills at the top to making sure that they can utilize such technologies. Back to the governance. So we have the Ministry of Health, where every single procedure, so even for Center of Excellence, so if this is a Center of Excellence for epilepsy, you have a policy and procedure for it. If this is a Center of Excellence for women and health, you have actually policies and procedures for that. So in Saudi Arabia, for every single Center of Excellence, you have a clear and detailed policy and procedure and patient workflow for every single procedure that will be done. Now, all doctors have to comply with those regulations. They cannot practice, as I said. We have what's called doctor's privilege. So if I'm a doctor, orthopedic, but I haven't done, again, the same example, knee replacement, I will not be permitted to do knee replacement because I have to get what is called the privilege, the doctor's privilege. So if you are not trained to do so, you cannot practice it, and so on. So those are actually some measures, and those are just some measures, where they will guarantee the delivery of the best care, and definitely not to go with 2 kidneys and get back with 1 kidney in some countries.
All right, let me get the chair, say something very quick, huh? No, yeah, once you hear the door and you start smelling it, it's in.
Yeah, I just want to add to Dr. Mohammed's answer to your question. So one of the things that this model is trying to really solve is the haphazard way people actually, as Kenyans, we go out and get treatment. I've dealt with cases myself that have gone through major treatment in a foreign country, and the insurance companies here are willing to pay, but unable to get the documentation. So what Sage and UMA as a partner here locally are proposing is actually to provide a path to the treatment so that you can actually follow the route of the treatment. You can get the full documentation. You can download it. You can, the customer can see it, and so on. So as opposed to a situation where someone was treated, a major reconstruction was done, the insurers are willing to help and pay, but the patient hasn't kept the documentation. The hospitals are foreign hospitals. They're not responding here. We don't know who they were. We have had cases like that, very many cases. So to solve that, the other cases, of course, are people, I mean, there are salesmen all over Kenya who are selling destinations. And because this has become a good business over the last 4, 5, 6, 7 years, you will expect good business people to create that route and make money out of it. And so around some of the destinations, very many hospitals came up. And some of them might not be really compliant with respect to regulatory and quality and so on. And so we have all of this, and so this model curtails that by providing pre-cleared hospitals, pre-cleared offerings, and a systemized way of capturing KYC in the patient and the entire journey from the point of intimation to return. In between, and the insurer, the local insurer here, if that person was insured, will be able to get a complete documentation for what was done. So that's also some of the things Sage is promising to do.
Thank you, Doctor.
So just before you sit, because I can smell the soup, why Kenya? I don't know, I think this is quick fire questions kind of thing. Yes, why Kenya?
We believe that, we believe that Kenya is a great hub for all East Africa, not only for Kenya. That's why we started with Kenya.
Okay.
From the beginning of 2025, we targeted 2 countries in Africa only and only, and we are glad that we are today in Kenya.
Absolutely.
So 1 in the West and 1 in the East.
Yeah.
And we are not, actually that's part of our strategy, not to be, may just use sell ourselves thin.
Yeah.
We want to making sure that we deliver the right service, and it's not about only the commercial part. I should not say that, but I don't think that hospitals and they are looking only for money, because this is not the only part that they are looking for. We are looking for open the country for utilizing and leveraging on an ecosystem that we have. And glad to share this with Kenya.
Okay. And I think just to also add, Kenya is the gateway for East Africa. And maybe the person who was asking is a Ugandan. We're okay with that. It's okay. We appreciate you with that. Just another quick one here. How many hospitals are within your network?
500.
Clear answer there. Then the final one here. Since Sage will assist with visa, do they offer options for how long the visas for patients will be valid before expiration?
So patients' visa is usually linked to the treatment plan. So it's unlike, for example, for Umrah, it's 90 days, for example. Unlike this, because some patients will go there for 6 months and some patients will go there for 1 week. So usually the treatment visa will be following the treatment plan. But definitely with the plus few days extra so that people can also enjoy their time while they are in Saudi Arabia.
All right. Let's appreciate Doc. Thank you so much for that session. Hey, people can ask questions. I think hunger is a prerequisite that is very nice. It works. It works. It works. Thank you so much. So in the house, ladies and gentlemen, you know, everybody knows when I say Sha. You know what I mean, right? I think it has been in our media houses everywhere. It has been a conversation. And the beauty of it is this. You cannot talk health without talking Sha, right? Yes, because that's where the majority of the people are covered under. And so we have Sha represented right here in a very good way. I just want to get very quick remarks from them. And we have Director Ibrahim Aliyu, the Director Corporate Service. He's going to come and tell us what he brought us before we take our soup. So please put your hands together for him as he comes. Director, karibu sana. Lovely, lovely. And I hope you're hungry so that you can make it fast.
I'm very hungry. Been in the office since morning. Good evening. Assalamu alaikum. Thank you so much. First of all, I want to introduce myself. I'm Ibrahim Aliyu. I'm the Director in charge of Corporate Services at Social Health Authority, SHA. And I want to, again, take this opportunity to, first of all, apologize that we are coming in late because we are just from another meeting. We were to join this meeting at around 6:30, but we have been held up in another meeting. So we came as a team from the same meeting. So our apologies. I'm sure we have lost a lot because there's so much that has been discussed here. But for us, I think for me, I want to, first of all, start by recognizing my colleagues who are here. And I will have requested that they be given mic to introduce themselves because we came 4 of us. So I have 3 colleagues here who I want them to introduce themselves.
Good evening, everyone. Good evening. Our apologies for coming late, but we are here, better late than never. My name is Golda Ella Kolo. I'm the Director, Claims and Benefits Management. Thank you.
Good evening, everyone. Sorry for coming late. My name is Jonathan Leeson. I'm the Director of Finance for SHA. Thank you.
Good evening, everyone. Apologies again. I think we can't say enough of that. But I'm Dr. Diana Marion. I am the Director, Provider and Beneficiary Management. And I want to tell the team that has planned this, thank you.
Thank you so much. I think that is just a brief introduction, but we're going to request basically after 2 minutes, I want to take 2 minutes of your time while we are here. When we hear we are having stakeholders who have stakes in health meeting anywhere, or when we hear Kenyans meet anywhere, we always come and take that opportunity to talk about SHA. Because SHA is a new entity. We started like a year ago, October 2024. I think this is October 2025. We are SHA at 1 now. SHA is an institution that grew from the existing institution that lived for 60 years, called National Health Insurance Fund, NHIF. And it came with, mixed reactions. There are people who came and embraced it immediately, and there are people who came and by the arrival of Shah actually opposed and are continuing to join us. And that is actually expected because any new entity or any new thing, and especially that is formed from the existing one, which people have known, will always attract some opposition. But on the way, it actually get acceptance because of what it is doing. So what is social health authority? For those of, I'm sure we are having veterans who know these things very well. I'm seeing like CEO of Reliance, Dr. Somane is here. I'm having someone who is actually seated in the board of SHA, KMA, whose representative sits on, on our board. SHA is an institution or an authority that has come to introduce an expanded mandate of NHIF. Because NHIF actually was limited in a number of grounds, on a number of grounds. One such ground is the coverage. And Kenya is actually heading towards achievement of universal health coverage. So when you are heading towards achievement of universal health coverage, you have to actually look at who you cover. So NHIF has only been covering basically the employed and few people who chose to be in NHIF. And actually it is started as an institution to serve only employed. SHA came to handle the issue of, discrimination where only some few people are the ones who are accessing healthcare. That's why you have seen that for 60 years, NHIF was able only to have 7.5 million members, and now in 1 year, SHA is having 27.5 million members, basically to increase that expansion. The other aspect is basically, and which is very important, is to operationalize the Constitution of Kenya 2010. Article 43(1)(a), basically that talks about right to health. And right to health, basically that clause goes ahead and says right to health and including right to high standard of health, including emergency medical care. NHIF have never had the emergency medical care. It was only one fund called National Health Insurance Fund. And therefore, SHA came to give effect to the clause of the Constitution, and by actually introducing around 4 funds. There are 3 funds, and also the one that NHIF focused on actually added to the 3 funds to become 4 funds. First fund is the Primary Health Care Fund. Primary Health Care Fund actually covers level 2 and level 3. This is the outpatient cover, where you just go level 1, level 2, level 3, and select level 4. Free walk-in and walk-out. And this is basically to strengthen the issue of preventive and also access to primary health care. This fund is 100% funded by government. And the NHIF, we never had any fund from government. So the government came on board to actually fund this. There's SHIF, Social Health Insurance Fund. Social Health Insurance Fund is the contributory. And this contributory, unlike NHIF, is actually bringing on board the aspect of equity. The contributory means the households contribute to the level of their income, 2.75% of the level of their income. And therefore, it wasn't like when a member of parliament who earns more than $1 million or $1 million has been paying 1,700, equivalent to the person who was earning probably 50,000. So this fund comes in to actually equalize, that you only pay certain percentage of your income. That then the haves are able to fund the haves not for the medical cover. And basically, this one is the one that actually deals with secondary level of no ailments. I'm not a medical doctor, forgive me. The third one is ECCIF, Emergency Chronic and Critical Illness Fund. This one was not also there before under NHIF, and this one is the most interesting actually. And we are even going ahead to have an emergency call center by the end of this month. This is the one that actually gives effect to the Constitution of Kenya, Article 43A, that any Kenyan who is faced with an emergency or an emergency situation will go into access free medical cover, at least for the first 24 hours, in any of health facility that offers such service. And this one is also covered 100% by the exchequer, by the government. We are now actually introducing a call center, 24-hour call center, by December, to make sure that if there is any emergency at home, on the street, on the road, you just call toll-free line and you'll be picked and taken to the nearest health facility, because it is GPRS enabled. We contract ambulances that are GPRS enabled. So the call center can see which ambulance is next or is within the vicinity of the emergency area, and which hospital or health facility can offer that. So we are actually transforming the health care system in the country. The fourth one, which actually NHIF actually focused on, is the Public Officers Medical Fund. This is an enhanced medical cover, and it actually came about as a result of basically civil servants who are entitled to their medical allowances and are usually are being paid through their pay slips, forfeited that allowances to the government and requested that they be provided with an enhanced cover. Other than paying the SHA, there is also payment of premium on top, and therefore they access also a superior cover because of their contribution, because of forfeiting. And we have had a number of people complaining, why two classes of people? It's because they have paid a higher premium by forfeiting what they have been enjoying in their pay slips. So these are the four funds that we are running. And at one time I was also a chief officer of health services in Isiolo County. And that time I had a privilege to be serving in a county and actually being a spearheading person of one of the counties that was selected as pilot counties for universal health coverage. And the result from that pilot is what informed the rollout of what we are currently having. And during my time in that docket of health, I discovered that the most important thing in health is basically to have, one, accessibility to the healthcare and affordability. Accessible, affordable, and quality. And that is now the pillars of universal health coverage, which now SHA is coming to actually actualize. So for us, why we are here is basically, is only that we don't have time. We wanted, and we normally work as a team, so that if we are having healthcare providers who have challenges, then we say, Director Claim is here about the issues of claim. If there is issues of payment, we have Director Finance. If there are issues of contracting and dealing with facilities, we are having director, beneficiary, and provider. If there is anything to do with customer service, Alio is here, corporate services. And some other times you also have others together, technical team, to come and actually talk about SHA. And we always value, really value our stakeholders. And why we are here, SAGE, which actually also visited our offices and gave us a brief of what they are doing and what they are doing in the country and what they are expecting, because we are borderless, basically is one of now our stakeholders who are going to make our vision a reality. So that's why we are here. I don't want to take a lot of time. I could have actually talked about it. I want to welcome my colleague Marion, just to talk about basically what probably SAGE has been talking about today, because that is her docket. Mine is just a brief. Asanteni sana. We can interact probably as we are having our soups. I am told there is soup available. So karibu sana, Dr. Mario. Thank you so much.
Thank you very much, Mr. Alio. And a very good evening to all of you. And I'm seeing a lot of my friends in the room. I'm seeing my former home in the room. SAGE, our newest friends. So I don't know how I'm going to do this, but I'll tell you, I was supposed to have prepared for a keynote speech. But they usually say soldiers must always be ready for war. And I can say I'm here. And that already says I'm ready for war. Now, I want to say a few things. The Social Health Authority, the Social Health Insurance, as a plan towards attaining universal health coverage in this country is an ambitious project. All of you say ambitious. It's ambitious because we are projecting coverage for each and every Kenyan, and this is at no out-of-pocket cost. That's the ambition that we are looking at. Now, when you're looking at an ambitious project, one of the things you have to look at is the challenges that you have to face to actually get there. But I'll tell you one thing, this plan, as we work on it, will be one of the most innovative plans in Africa. All right? Countries in Europe, countries in Asia have done it, and that's where we derive our hope. Now, what we have done is look at how we can pool our resources so that we can deliver this service to Kenyans. And when we are talking about pooling the resources, what does it mean? That there's a concept of the tax-funded part in it, and there's the concept of the government in it. And what Mr. Alio spoke about in terms of the types of funds that we have exist, and those funds have been tailor-made to cover for specific programs for the Kenyans. So the primary health care, which is supposed to cover 60% of the healthcare needs of Kenyans, is basically preventive and promotive. So all services that are preventive and promotive are going to be covered by that fund. The Social Health Insurance Fund is supposed to give comprehensive healthcare to Kenyans. And that includes whether it's your specialist services, whether it's your surgical services, that's where that comes in. The Emergency, Chronic, and Critical Illness Fund is supposed to make sure that Kenyans don't fall into the trap of becoming poor because they were catering for emergencies. Remember, you don't plan for emergencies. Remember, critical care illness can really dig very deep into your pockets. So that is really the plan. So when we look at, one of the things that has happened is that we started with the Constitution 2010, make sure that healthcare is basically a right, and it's the responsibility of the government to deliver this right to the Kenyans. And health financing is one of the biggest pillars that are very important in delivering that. We are not only looking at financing healthcare, but we are actually looking at delivering quality healthcare to Kenyans. So for us, as we look at financing, we are also going to look at quality metrics. We are going to look at how is it that our institutions can reduce mortalities? How is it that our institutions can reduce morbidities? So all these are part of the bigger plan for the Social Health Authority. Now, we are looking at how we are going to have what we call strategic partnering. And strategic partnering is very important because then it takes care of specific scenarios that we might not be able to take care of. So in short, we are looking at the universality of this program. Now, when we talk about the laws and the regulations, the very first thing that happened is that we had to go into various reforms. And these various reforms have been strategically been put in place by looking at the various laws and regulations that should protect every single event in this particular bigger plan. Now, if I go straight to the strategic partnership, and that's where SAGE comes in. I know we are late, so I don't want to really, I can say a lot of things. So so I just want to go into, there's the concept of overseas treatment. And one of the things you have to look at is, we did gazette procedures that our Kenyans can get overseas. What does that mean? Any service that is available locally does not fall in that list. So as we are partnering, we are looking at only procedures that are not available here. And how did we go through that process? We actually engaged various institutions to come up with that list that was gazetted. Now, what is the process, or what does the process briefly look like? So the process is that all patients that have to go for overseas treatment can only be referred from our level 6 hospitals, which is our highest tier of service provision. So level 6 means level 6 private, level 6 public. Now, the second thing, they must be referred by an accredited professional, and we must be able to check that those services are either not available or the specialist is not available locally. So that is part of the regulations that we are looking at, so that we don't end up moving patients that can get services locally, and also so that we also don't disenfranchise our local service providers. How are we going to do this? We are going the same way we empanel and contract local providers is the same way we are going to empanel and contract overseas providers. And how will that happen? The laws and the regulations around empanelment and contracting will apply. And beyond that, the laws that provide for regulation in that particular country will apply. So we will have to counter-check with the regulatory authorities of those countries and be able to really know which institution are we talking about, which service providers are we talking about. Beyond that, we are going to do something we call basically a KYC, know your customer, and we are going to be able to have processes that allow us to know what these institutions have and what it is they are able to offer by doing a background check on all of them. Our focus is on the gazetted 36 procedures, and they are going to go through the same process in terms of the benefit package and tariffs, and we have institutions that are responsible for that. We are going to do what we call strategic purchasing of health services, which is still part of what is within our regulations, and we are going to continue to monitor all these facilities and their service providers to keep on ensuring that they are providing what we contracted them for. So in short, that is exactly what we are looking at. So what I would tell Sage, that's the process. It's very fair to whoever we will engage, and what we are hoping for is a partnership that is going to, number one, not only improve the health of our Kenyans, but not send, basically protect the Kenyans from any advanced medical costs. We are also hoping to expose and have strategic partnerships where we can have our providers train within institutions where they can be able to bring this back, the expertise back to our country, such that if it's something we didn't have, then part of this partnership should be able over time to make sure that we have these services within our country. So it's a stopgap measure, and we are looking at a relationship that is going to not only improve our services, but improve the kind of care that we give the citizens of Kenya. Thank you.
Thank you very much. Ladies and gentlemen, you will understand when the government is speaking, you don't cut them short. But they were talking very good things, by the way. Thank you so much. Because in fact, I wanted to ask the question, so for us at Sage, right? At Sage, she was calling it Sage. How do we benefit? And thank you for the policies. That yes, you're putting things together for us to go and access healthcare there. Thank you so much. We appreciate that. I will extend an olive branch, and I've told the CEO, Group CEO Uma, that you know what? You know, it's like doing business. You're in business with Kenyans, definitely. That's the point. Everything is transactional, you know? But they say this in the world of business. Doing business without advertising, it's like winking at a girl in the dark. It doesn't add any value. So you have to talk and talk about it. Whenever you see a mic of Citizen, talk. And I like that you took advantage. Talk. Let Kenyans know, because they end up watching that. And you know what? How you beat misinformation is by giving proper information. And thank you so much. Ladies and gentlemen, what's your takeout? I'm about to give another just 2-page speech and then we are done, right? No. I want you to look at the person sitting next to you and to ask them what's their takeout from today's conversation. Right now. I got 2 minutes, or otherwise I'll read the speech and there will be no soup. Yeah. Yeah, lovely. Uh-huh. Yeah, lovely. Yeah. I can see people saying, yeah. My question only is this. What would the directors of SHA be telling each other? That would be interesting. All right, there you go. And I think, so one of the things I would want you to do, because if you just right now type and text, I've just tried it right away. If you type right now and just check Sage Healthcare in Saudi Arabia, you'll see a link definitely there. Let people know, all right? I have to confess as well and say this. Sometimes when we think about overseas, we have always thought of only one place. Now you have more options, all right? That there are many other places you can go and still get proper quality healthcare at affordable pricing and back without any knee, let me use the example to look like a doctor, without any knee issues, you know? So thank you so much once again. No more conversations. The soup is now getting cold. So we have to take it. So mine is just to appreciate you, to thank you for your time. and for being here on a Friday evening. This is not for granted. So we really appreciate you for that. So please enjoy dinner. But just before you go out, we're going to take a very nice group picture. And I can see the photographers are ready. Just a group picture. It's just to confirm. It's always good. For the sake, you know, when you look at a sage means also people who have been there. That even when we shall be so successful just going to Saudi and back anyhow for tourism, for anything, the people will know there were people who met to make this work. Make sense? So photographers, if you don't mind, I think you could kindly come and quickly arrange this. We shall all fit here. So some will stand down here and then up here. So what about this? Are you going to move it? Yeah, please come. You can move it. I don't need it anymore. No more speeches. We don't want anything else. Please come. We do that and then enjoy dinner. Karibuni sana. Thank you so much. Yes, there you go. You can just pull it aside. So, if you don't mind, my table here, be here, right here at the center, that kind of thing. And then everybody else come. Come join me here. Come join me here. Chairman, come right here. Come right here. Don't network now. Don't hug. Come first. Yes. Good. Ladies and gentlemen, we're waiting for you. Come. Picture. Yes. There you go. Yes, we are waiting for you. Yes. Welcome up here. Don't worry. There you go. Yes, you can put some seats there. Yes. Because some people have a clock. By this time, they will be in bed. So, yeah. So, Chairman, you will have to sit. Because I put in front of you. If there's a seat in front of you, sit fast. Yes. Just sit on it. There you go. Lovely. Yes. No. You sure? Okay. These people are interesting. Where is Shah? Where are they seated? Oh, they must be there, just to confirm that we are together. Lovely. Excellent. That's looking good. No, I think if you say Shah, you'll be shocked. I think today we'll say Sage. Yes, Sage makes you smile. Yeah. Excellent. One last one. There you go. Yeah, that looks good. So please, if you know that your height is that one, make sure you are the front of someone else. I don't want to say short, and then you start saying, I called you. Lovely. So I don't know why there's a bit of a bit of crowding. So can we have some people cross over to this other side? It will be fine. Yeah, one or two people. The servant leaders. Yes. There you go. Yes, you can take my center stage. It's okay. There you go. Lovely. Are you ready? Excellent. Everybody say Sage. Lovely. So you'll say that in the count of 3, all right? So don't look at me, look at this person. Don't look at anybody else. These are the original ones. The others are fake. So in 3, 2, go. Did you do it?
Yeah, we are waiting
there was a banner. Is it a Shah banner? Just checking. You will never forget Shah. Shah banner. Awesome. All right, you ready? One more time? Excellent. So in 3, 2, go.
Okay, again.
Oh, Sage.
Let's do the Kenyan one. Okay, on the count of 1, 2, 3. Wave to me.
All right, okay. Shah, you're moving too fast. So quick instructions. When we are serving dinner, that's the first.
Saudi Arabia is opening its healthcare system to the world. SAGE is the healthcare concierge partner connecting global patients, facilitators, and institutions to Saudi Arabia's top centers of excellence. We manage the full medical journey from cross-border referrals and digital coordination to personalized care and after-treatment support. Working with government, facilitators, and private providers, we're shaping Saudi Arabia into a globally trusted destination for medical and wellness care. Discover Saudi Arabia, the wise path to healthcare.
And when you fall asleep,
Saudi Arabia is opening its healthcare